If you have knee osteoarthritis, your doctor probably gave you one main piece of advice: keep moving, keep walking. And they are right, mostly. But what nobody tells you is that the way you take your steps every single morning might be the exact reason your cartilage is wearing away faster than it should. You might be doing exactly what you were told, trying to stay healthy, while quietly driving your knees straight toward a severe bone-on-bone diagnosis. Hello, I'm Dr. Marcus, a doctor of physical therapy specializing in geriatric orthopedics and joint biomechanics. In my clinic, I see seniors every day who are frustrated, exhausted, and in pain because their healthy daily walk is actually punishing their joints. By the end of this video, I'm going to show you the hidden biomechanical mistake almost everyone with knee stiffness makes, how to test your own walking mechanics right at home, and exactly how to shift that damaging shock absorption away from your knees today. But before we get into the anatomy of a joint-safe step, I want to hear from you. Drop down into the comments and let me know right now. Which knee gives you the most trouble during or after your daily walk? Is it the right, the left, or is it both? Let me tell you about a patient I worked with recently. Let's call her Margaret. Margaret is a 68-year-old retired school teacher living over in Grand Rapids, Michigan. She is fiercely independent, loves tending to her garden, and when she was diagnosed with mild knee osteoarthritis 3 years ago, she didn't just sit down in a recliner and give up. She fought back. She bought top-of-the-line walking shoes and committed to walking 2 miles around her neighborhood every single morning. She was doing everything right. At least, that's what she thought. But a few months ago, Margaret sat in my exam room in tears. She told me that after her morning walks, her knees would swell up like balloons. The stiffness was paralyzing. It got to the point where, after 2 miles of healthy exercise, she was practically crawling up her front porch steps just to get back inside her house. She was terrified of losing her independence. She looked at me and said, "Dr. Marcus, I am doing exactly what I'm supposed to do. I'm staying active. Why am I getting worse? Am I just destined to lose my mobility and end up needing surgery?" Margaret wasn't destined to lose her mobility. Her arthritis wasn't rapidly accelerating on its own. The problem wasn't that she was walking. The problem was how she was walking. And what I explained to Margaret that afternoon is what I want you to deeply understand about your own joints right now. When you take a step on a hard surface like concrete or asphalt, your foot hits the ground, but the ground also hits back. In biomechanics, we call this ground reaction force. Every time your foot strikes the pavement, a shockwave of kinetic energy travels up your leg. When you walk with optimal, healthy mechanics, your body acts as a brilliant, highly tuned shock absorber. Your foot rolls smoothly, your ankle flexes, and your large hip muscles, specifically the glutes, activate to absorb the brunt of that impact. The force is safely distributed across a massive network of muscle and tendon, and your knee joint simply acts as a smooth, relaxed hinge. But when we develop arthritis, or even just when we spend decades sitting at desks and in cars, our natural mechanics change. We subconsciously alter our gait to avoid the initial sharp twinges of pain. Over the years, this temporary limp or compensation becomes your permanent walking pattern. We start walking with what I call the heavy heel strike. Instead of gliding, we throw our leg out far in front of us. We lock our knee completely straight out of a hidden fear of it buckling, and we slam our heel aggressively into the ground. When you do that, you bypass your body's natural shock absorbers entirely. That ground reaction force, which can be up to 1.5 times your entire body weight with every single step, shoots straight past the ankle and slams directly into the knee joint. Think about the math for a second. If you weigh 160 pounds, that means your knee joint might be taking a 240-pound hit, thousands of times over a 2-mile walk. Now, imagine doing that to a joint where the protective cartilage, the smooth, slippery meniscus that provides the cushion, is already thinning, fraying, or dehydrated. You are essentially taking a hammer to a highly compromised, sensitive surface. It doesn't matter how thickly cushioned your walking shoes are. If your bones are aligned in a straight, locked position to absorb maximum impact, the joint itself will take the structural damage. This is the silent trap so many active seniors fall into. You think you are lubricating the joint, building stamina, and keeping the rust off the hinges, but with every heavy locked knee step, you are dramatically increasing the shear force within the joint, physically grinding the remaining cartilage, and worsening that deep, aching, bone-on-bone friction. When I watched Margaret walk down the hallway of my clinic to assess her gait, I saw exactly this. She had a pronounced heavy heel strike. Her leg was rigid when her foot hit the ground. She wasn't walking, she was marching. And every time her heel struck the linoleum floor, I could practically see the shockwave traveling up her shin and vibrating right through her knee. She was taking roughly 4,000 steps every morning. That was 4,000 preventable microtraumas to an already arthritic joint. To break this vicious cycle of pain and wear and tear, we have to look past the knee itself. In almost every case I see, the knee is just the victim of what the foot and the hips are failing to do. It is taking on a job it was never designed to handle. To understand exactly why this happens, we have to look at what I call the heel strike heavyweight problem. Let me tell you about another patient of mine, Richard. Richard is a 71-year-old former auto mechanic. His knees have taken a beating over the decades, and when his osteoarthritis flared up last year, he did what millions of people do. He went online and bought the most expensive, highly cushioned, thick-soled walking shoes he could find. He figured that if he just put an inch of premium foam between his foot and the concrete, his bone-on-bone pain would vanish. But a month later, Richard was sitting on my exam table, icing a swollen left knee. He was incredibly frustrated. He had the best gear, but his pain was actually getting sharper. Here is what Richard didn't realize, and what shoe commercials will never tell you. You cannot outcushion poor biomechanics. When you wear a shoe with massive heel cushioning, you actually lose the natural sensory feedback from the ground. Because you can't feel the impact as sharply, your brain allows you to strike the ground even harder. Richard was throwing his leg out, locking his knee joint perfectly straight, and slamming that thick foam heel into the pavement. The foam compressed, sure, but the kinetic energy didn't just disappear. That shockwave shot right through the foam, straight up his rigid tibia, and crashed directly into his arthritic knee joint. Your knee is, at its core, a hinge joint. It is brilliantly designed to bend and flex, acting like a spring to absorb weight. But when you walk with a locked knee and a heavy heel strike, you disable the spring. You turn your leg into a rigid pole vault. And if the cartilage inside that joint is already thinning from age or wear and tear, that daily walking habit is physically grinding away whatever protective tissue you have left. Before we go any further, I want you to try a quick diagnostic test right in your own home. Grab your absolute favorite, most worn pair of walking shoes and flip them over to look at the tread. Where is the rubber most worn down? Is it the very back edge of the heel, the inside edge of the foot, or the outside edge? Tell me in the comments below, because that wear pattern is a massive clue to exactly how you are transferring shock into your joints. If the back of your heel is completely chewed up while the rest of the shoe looks relatively new, you are a heel strike heavyweight. But the heavy heel strike is only half of the equation. To truly stop the progression of this daily joint damage, we have to talk about the hidden culprit behind almost all chronic knee pain: sleepy glute syndrome. When you walk, you don't actually spend that much time on 2 feet. Walking is essentially a series of single-leg balances. For about 60% of your walking cycle, your entire body weight is being supported by just one leg. When you step onto your right leg, your right hip muscles, specifically a muscle called the gluteus medius, located on the side of your hip, have to instantly fire and contract. Their job is to keep your pelvis level and hold your leg bones straight. But as we age, and especially because modern life requires us to sit in chairs, on couches, and in cars for decades, our glute muscles literally fall asleep. They become neurologically underactive. They lose their tone and their firing speed. So, what happens when you take a step on your morning walk and your sleepy glute fails to fire? Your pelvis drops on one side. Your thigh bone, the femur, subtly rotates and collapses inward. And suddenly, your poor knee joint, which is only meant to hinge forward and backward, is forced to twist and absorb massive lateral shear forces just to keep you from falling over. Your knee is desperately trying to do the balancing job that your hip is supposed to be doing. This inward collapse, known as dynamic knee valgus, is the exact mechanism that shreds the medial meniscus, the cartilage on the inside of your knee. If you have deep aching pain on the inner side of your knee joint, this glute disconnect is very likely the root cause. You are walking thousands of steps a day, and with every single step, your femur is twisting and grinding against your tibia because your hip muscles are asleep at the wheel. You can take all the joint supplements in the world, you can ice your knee every night, and you can get expensive cortisone injections. But if you don't fix the mechanics of how your foot strikes the ground and how your hip stabilizes your weight, you are just putting a Band-Aid on a leaky pipe. The friction will continue. Now, I want to be perfectly clear. If you have grade 4, severe osteoarthritis with structural instability, where the joint space is completely gone and you are experiencing buckling or locking, you need to be under the direct care of an orthopedic specialist. Changing your gait will not magically regrow cartilage that is completely gone, and you should never cancel a doctor's appointment just because you watched a video online. But for the vast majority of you experiencing that daily, agonizing stiffness, modifying the forces placed on the joint can provide life-changing relief. It can extend the life of your natural knee by years, if not decades. If you are currently working with a physical therapist or seeing your doctor for knee pain, I want you to write this exact question down and take it to your next appointment. Can you evaluate if I am overly reliant on my quads and underutilizing my posterior chain when I walk? Getting a professional to watch your hips and ankles while you walk is the most crucial step in preserving your joints, but you don't have to wait for your next appointment to start making changes. There is a very specific practical way to actively override this joint-destroying habit starting today. We need to wake up your hips and completely alter how your foot interacts with the pavement. So, how do we fix this? How do we take that massive, joint-destroying shockwave out of your daily walk? We are going to implement a simple, 3-step, joint-safe walking protocol. It requires zero equipment, and you can start doing it the second this video ends. Step 1. The pre-walk wake-up. Before you even step out your front door, we have to turn your hip stabilizers back on. Remember those sleepy glutes we talked about? You cannot expect them to suddenly start working just because you started walking. You have to actively prime them. Stand next to your kitchen counter for balance. Shift your weight to your left leg. Keep your body perfectly straight and slowly lift your right leg straight out to the side just a few inches. Do not lean your torso. Let the side of your hip do all the work. Hold it for 3 seconds and bring it back. Do 10 of these on each side. You should feel a deep, warm burn right in the side of your buttocks. That is your gluteus medius waking up. By doing this right before your walk, you are sending a neurological signal to your brain, reminding it to use those muscles to stabilize your pelvis rather than forcing your knee to take the twisting forces. Step 2. The micro bend and the soft roll. We have to eliminate the heavy heel strike and the locked out knee. When you take a step, I want you to focus on keeping a tiny, almost invisible micro bend in your front knee as your foot meets the pavement. Never lock the joint straight back. Next, instead of aggressively pointing your toes to the sky and slamming the back of your heel into the ground, think about landing slightly flatter. Aim to strike the ground with a soft heel or even your midfoot, and actively think about rolling smoothly through the foot and pushing off with your toes. Imagine you are walking on thin ice or trying to sneak through the house without waking someone up. That soft, rolling, bent knee landing instantly transforms your leg from a rigid, cartilage-grinding pole into a brilliant, spring-loaded shock absorber. Step 3. Shorten your stride. This is the hardest habit to break. When we want to walk faster for exercise, our natural instinct is to take massive, long strides. But the further your foot lands in front of your center of gravity, the higher the braking force is, and the more impact your knee absorbs. If you want to increase your heart rate, do not take longer steps. Take shorter, quicker steps. Keep your feet closer to being directly underneath your body. A shorter stride drastically reduces the shear forces tearing at your meniscus and keeps the workload in your powerful thigh and hip muscles. I taught this exact 3-step protocol to Margaret. I told her to cut her usual 2-mile walk in half for the first week, just so she could focus entirely on her mechanics. At first, she told me it felt incredibly strange. She had to actively think about every single step, keeping that micro bend, softening her heel strike, and keeping her steps short. But when she came back into my clinic 3 weeks later for a follow-up, the difference was night and day. She wasn't crying in pain after her walks anymore. Her post-walk swelling had almost completely disappeared. She looked at me and said, "Dr. Marcus, my stiffness is down by at least 70%. I feel like I have my legs back. Listen to me. An osteoarthritis diagnosis does not mean your walking days are over. It doesn't mean you have to lock yourself in the house, give up your independence, or just passively wait until you need a total joint replacement. Your body is incredibly resilient. Your joints want to move. But when you have bone-on-bone friction, your body is begging you to move smarter, not harder. You have the power to change the mechanics of your joints today. Now, I want you to take action. Make a commitment to your joint health right now by dropping into the comments section. Comment. Starting today. If you are going to use this soft roll and glute squeeze routine on your very next stroll, comment. Asking my doctor. If you plan to bring up your gait and hip strength at your next physical therapy or doctor's visit, comment. Sending this. If you have a walking buddy, a spouse, or a friend who complains of knee stiffness and desperately needs to see this. If this video helped you understand your body just a little bit better, please hit that like button, share it with someone you care about, and make sure you subscribe and turn on notifications. I post new joint-saving mobility guides here every single week, and I don't want you to miss the next one. I'm Dr. Marcus. Keep moving, but move smart. I'll see you in the next video.